Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today we're going to talk about microneedling, also known as collagen induction therapy, and this is one of the fastest growing treatments in aesthetic medicine, and for good reason. It's minimally invasive, it works across a wide range of skin concerns, and it has a relatively short downtime compared to other things like lasers or deeper resurfacing procedures. So let's start with the basics. Microneedling uses fine sterile needles to create controlled micro-injuries into the skin. And the idea is to actually stimulate the body's natural wound healing cascade. And when the skin senses that these tiny punctures, it responds by releasing growth factors, increasing the blood flow and stimulating fibroblasts to make new collagen and elastin. So over time, that remodeling process helps strengthen the skin, smooth texture, soften scars, and actually improve tone. Now, a little bit of history about microneedling. People have been experimenting with skin puncturing techniques for centuries, actually, but modern microneedling really took off in the 1990s with the introduction of the dermal rollers. So since then, we've moved into more precise technology, like automated microneedling pens and even radio frequency microneedling, which adds a thermal energy for tightening and deeper collagen stimulation. So what can microneedling actually treat? A lot, really. We use it for skin rejuvenation, to soften fine lines and wrinkles, reduce pore size, and improve overall skin texture. It's also excellent for acne scars and other traumatic types of scars, and it has applications in treating stretch marks, certain types of hyperpigmentation and melasma with caution in the right person, of course, and it's also being used for hair restoration because those little microchannels can actually stimulate the follicle environment and enhance the absorption of other topical treatments like PRP or growth factor serums. But of course, it's not for everyone. We avoid microneedling in patients with active skin infections or severe active acne or poorly controlled medical conditions that can potentially impair wound healing, like uncontrolled diabetes. So people with a strong tendency to form keloids are also a relative contraindication, and we generally avoid it during pregnancy or breastfeeding simply because the safety data isn't as well established. Now, let's talk about the techniques and the actual microneedling devices. The simplest is the derma roller, which is essentially a rolling cylinder with tiny little needles. You can find these on Amazon. It's inexpensive, but it doesn't really give great precision. Now, more commonly today, we use automated pens with actual disposable needle cartridges, and these allow us to set the exact needle depth, which is critical. So for example, you need at least about 0.25 millimeters for products to be absorbed, and about 0.5 to 1 millimeters for fine lines or pigments, and a deeper 1.5 to 2 millimeters for the deeper acne scars and stretch marks. And then there's radio frequency microneedling, which actually combines the needles with a heat energy, which add to the collagen stimulation and tightening effect. We can also combine microneedling with other therapies and modalities, such as PRP. You may know this as a vampire facial. It's a platelet-rich plasma that's packed with growth factors, and it can accelerate healing and enhance results. You can use hyaluronic acid serums, vitamin C serums, peptides, and even newer biologics like exosomes are immediately applied after the microneedling. And these microchannels are still open, so you have maximal absorption. And exosomes are lab-derived stem cells that can actually promote skin regeneration, collagen production, and tissue repair in a much higher concentration. PDGF, platelet-derived growth factor, is similar to exosomes, and these are really one of the ways that we can maximize the outcomes of microneedling. Now, so what is the process like? First, we prep the skin, we clean the skin, and then you can apply a topical analgesic, lidocaine, for about 30 to 45 minutes so that the patient is comfortable. And once the skin is numb, we clean it again with the antiseptic and then begin the microneedling passes. And usually you'll do multiple passes in different directions to make sure that you cover evenly. Afterwards, patients will look pink to red, almost like a little sunburn, and that usually settles down within 24 to 72 hours. The instructions are sun protection. SPF is so critical. Avoid harsh skincare for a couple of days and make sure you keep the skin hydrated and moist. How about the results? So this is not a one and done treatment, and most patients will actually need a series of treatments, usually about 3 to 6 sessions spaced about 4 to 6 weeks apart. And the improvements actually build gradually, with peak results seen about several months down the line as the collagen remodels and builds. And in current studies, the microneedling has shown outcomes comparable to fractional laser resurfacing for acne scarring, but with fewer side effects and much less downtime. What are the risks? There are risks, but they are generally mild, and those are the redness, the swelling, the little tiny pinpoint bleeding. These are expected. Infection is also possible if sterile technique isn't followed, and in darker skin types, my melanated people, there is a risk of post-inflammatory hyperpigmentation, or PIH. So we really need to be careful with the depth and how deep the needle is going, and pre-treat with certain medications if necessary. Scarring is rare, but always possible. Compared with other modalities, microneedling really holds its own. It's safer for darker skin tones compared to a lot of other lasers. It is less harsh than the deeper chemical peels, and although it doesn't replace surgery, it does fill a very important space for patients who want meaningful results without having a more invasive procedure. Clinically, my pearls would always be adjust the needle depth based on the indication. So obviously more superficial to deeper, and never underestimate the importance of the right patient selection, and emphasize the aftercare. Again, sun protection, proper skincare, makeup, all of these can affect the final result. And combining microneedling with other PRP or serums or PDGF or exosomes or radiofrequency often tend to give the best outcomes. Looking to the future, we're seeing innovations like microneedling patches for at-home use, smart microneedling devices with sensors, and an increasing combination of regenerative medicine, and those things like the stem cell-derived exosomes and serums. So to wrap everything up, microneedling is a versatile, safe, and effective treatment that really works by harnessing the body's natural healing response. And when it's done properly, it can improve the scars, pigmentation, texture, and even hair growth. I hope you learned a lot from this lecture. Stay tuned for other informational videos.